I thank the chairman for the recognition. I want to welcome our senator from Texas, Senator Cornyn, and my fellow OB-GYN, Dr. Rowe, for welcome them to the committee and being here today. This healthcare law that was signed 15 months ago contains countless policies that will essentially disrupt the practice of medicine. Along with the many excesses and constrictions in the law, the Independent Payment Advisory Board represents the worst of both. I'm a doctor, member of Congress. I'm also someone in my 60s who is soon to be Medicare age, and I am distressed by what I see happening with the Independent Payment Advisory Board. It's not accountable to any constituency. It only exists to cut provider payments to fit a mathematically created target. Given that private insurers use Medicare as a benchmark for their own payment changes, the IPAB could have a far-reaching implication beyond Medicare for our nation's providers. The board exponentially and inappropriately expands the power of the executive branch, giving an unaccountable panel of 15 individuals the authority to make changes in the Medicare program. It takes the authority away from Congress. Congress has no say in the board's reports, yet their recommendations essentially hold the power of legislation. And yeah, this board's appointed with the consent of the Senate, but not necessarily, because 9 of these board members could be recess appointments. 9 of these board members would constitute a majority, therefore completely bypassing the legislative branch. Now, for patients, these bureaucrats will be able to cut payments so low that it will block care to seniors. It does change the fundamental nature of the relationship of the federal government and those people who are cared for by insurance provided by the federal government. Now we'll be able to tell you who gets care, where the care is given, when it's given, but the fundamental change is now we'll be able to tell you when you've had enough. The board is not a solution in search of a problem. Medicare's unfunded liabilities are enormous. That's why Republicans want to be able to keep Medicare for future generations by lowering the cost to the federal government by providing better choices.